So hello and welcome to today's ICHOM's webinar. My name is Zofia Das-Gupta, and I'm delighted to be joined by my guests today, Sumalee and her colleagues. We have an exciting session ahead, exploring innovative approaches to cardiac surgery care. We'll be focusing on integrated networks, digital health, and enhanced recovery protocols to improve patient outcomes. In today's sessions, we will cover quite a few subjects. The power of collaboration. We'll talk about how strategic partnerships with local hospitals can expand access to vital cardiac surgery services. We will talk about the telemedicine and digital health and how leveraging technology can optimize outcomes, reduce the cost, but also strengthen hospital-patient relationships. We will talk about ERA's implementation blueprint. This is a step-by-step guide to delivering a patient-centered, enhanced recovery after surgery program. And finally, we will talk about how the protocols from that programs are actually leading to measurable patient benefits. We will also explore key lessons in value-based healthcare and also an insight from the ERA's implementation results and the role of the ecosystem collaboration in strengthening the healthcare system in Thailand. But before I hand over to our guests, I'd like to take a moment to introduce the ICHOM accreditation program, as that's where this journey began back in 2023. So can I have next slide, please? Bangkok, Pattaya was among the first providers of ICHOM accreditation. Then in November last year, we officially launched the full program, a comprehensive, condition-specific accreditation model designed to both a learning process and a pathway to excellence, consisting of 3 levels. Level 1, successful implementer, demonstrating initial implementation of value-based healthcare principles. Level 2, experienced implementer. This is a movement, and this program is complementary to other accreditation models with a very unique focus on patient-reported outcomes and structure built around the work. Next slide. Thank you. So we now have several accredited hospitals, including our guests today, making this the perfect moment to transition to our discussion. So without further ado, let me hand it over to Sumalee, and I'll be asking you as well to introduce your colleagues that join you today.
Good day, everyone. First, I would like to sincerely thank ICHOM for inviting Bangkok Hostel Pattaya for share our project with you today. It's an honor to be here to share and to have the opportunity to share insight and our project with experience. And I have the colleague stay with us to share with the information and share with the question from you all. Okay, thank you. And as mentioned, my name is Sumalee. I have been managing and supervising in this project. Today, I am excited to share insight and experiences from our project, hoping they will be valuable for you. And to give an overview, today's session will be structured as follows. First, introduction with our organization, service design, improvement planning, and outcome. Additionally, I will discuss with the challenges we face and the lesson learned and the key success factor. Okay, please next slide. Okay, let me begin by introducing our organization. Bangkok Hospital Pattaya, we are the largest premier hospital and we are the only private tertiary care hospital in eastern region of Thailand. Please next slide. Bangkok Hospital Pattaya is the one of Bangkok Dusit Medical Services. BDMS stands for Bangkok Dusit Medical Services. Now currently we have 58 hospitals. Please next slide. Okay, with the Bangkok Hospital Pattaya, we are from the Bangkok, around 1.5 hours from Bangkok. Okay, please next slide. Okay, this slide is our vision and mission that guide us in the same direction to create the value in the healthcare system that I show you with next slide, and that the session for today. In 2022, we launched the value-based healthcare as a part of our strategy to drive and transform our organization, and exciting project await in the next slide. Okay, this slide I would like to share with the project we call Mission to the Moon. Our goal is improving healthy life expectancy to greater than 85 years. Initially, after we launched value-based healthcare, we have been focusing first on the heart. We would like to increase healthy life and greater than 85-year-old, and brain and bone, and also free from the cancer. And please next slide. Okay, the improvement journey has been ongoing, and in 2023 we are proud to be certified by ICHOM in CAD and stroke, and again in 2024 in heart failure and diabetes. Please next slide. Okay, that I talk about with the value-based healthcare. Our organization launched in 2022. The value-based healthcare transform our perspective to focus on the patient viewpoint. We design the service based on the patient-centric approach and focusing on improving accessibility to care while optimizing costs. On right, we still enhancing quality outcome, and I will share you how we prioritize and how we implement this key strategy within our organization. Please next slide. Okay, from the value-based healthcare strategy, as you know, we have the 6 key strategy, and I will share you with next slide how we prioritize and implement the key strategy of value-based healthcare. Okay, from my observation, the integrated patient unit is the first key strategy. We have organized team into IPU and led by the physician leader. We have the multidisciplinary team to share their roles and approaches with the patient-centric focus. And also we have the coordinator. That's a picture I show you. We have 2 coordinators who work closely with the patient and team, acting like a care manager to coordinate care. Additionally, we have extend to measure the clinical report outcome, patient report outcome, and cost. Okay, please next slide. Okay, Please let me quickly to share how we measure outcome and cost. Please next slide. This slide I show you, we measure the outcome with the hierarchy to 3 tier. Please next slide. Okay. But for the measure and monitor the cost, I would like to share you, we have explored the cost throughout the entire patient journey and design a service flow that support and align with the patient journey to optimize cost. That the patient journey we expand to pre-hospital, pre-operation, in-hospital, and continuing of care. Each step we identify and we need to fix or we reduce the cost for the patient. And we have also adopted the evidence-based practice to manage the cost of treatment while maintaining excellent outcome. That I will share you more detail in our project. Please next slide. Okay, for the next the strategy that I will share you. Please next slide. This slide I will share you. We have also used the care cycle integrated to service flow. This is I will mention for the heart surgery. We have the pre-operative surgical intervention and post-operative care. That this step will guide us to bring and to identify the outcome. That I will explain to you when I share you with our project in heart surgery. Okay, please next slide. Please next slide. Okay, the heart surgery project at Bangkok Hospital Pattaya, we have goal to enhance surgical treatment accessibility and reduce wasting time for surgery. Please next slide. And we are committed to enhance and ensuring that everyone individual receive comprehensive care based on standardized protocol, aiming to provide comprehensive and compassionate care for everyone in need of cardiac surgery. Our hospital launched 2021 our collaborative project partner with the government hospital to enhance accessibility and reduce waiting time across the eastern region of Thailand. That I will share with how we build the relationship and how we build the network to provide excellent care for the patient in the eastern regions. Please next slide. This slide I will show you. We have the patient journey that I share you the previous slide. We focusing on the whole patient journey. This slide I will share you. We have the patient, their home country, their home is far from our organization, around 180 kilometers and 200 kilometers. Some of them have challenging with traveling, such as transportation or illness. This is the problem from patient perspective. We use to develop the service pro to support our patient. Okay, how we have the collaboration and how the network is powered to provide excellent care for patients in eastern region of Thailand. With a collaborative between public hospital and private hospital, we share the same goal to enhancing access to surgical treatment and reducing obstacle or service gap within the network. Is that may be effect to the patient. We are driving collaborative between private and public hospital. So we have to the key factor to providing the excellent care for heart surgery for patient. Having first, we have using the clear goal how we would like to provide the excellent care for the patient. The second, we have the ensuring easy to access to coordinating channel, and we using the standardized protocol for the patient. And finally, it's important to building relationship. We have building the relationship through open feedback, support, and regular meeting, and also academic conference within network. Please, next slide. This is the multidisciplinary team that I shared you in the previous slide. They work closely to provide excellent care for the patient. Please, next slide. And this slide I will show you. We have the cardiac thoracic surgeon who are the main of team and lead our team. And we have cardiac technologists. We have the nurse coordinator, and we have physiotherapist, and also we have the nutrition, and we have the pharmacist and nurse and anesthesiologist. This team to use their role to provide the excellent care for heart surgery. Please, next slide. Okay, this slide is our dream to make things happen. This slide I will share you with the service design that I show you the previous slide with the healthcare services or network in Eastern region of Thailand. We identify the patient problem, limitation, and challenging. This slide, we would like to be a healthcare system to connecting with the patient through effective networking and digital ecosystem technology, and integrated to care cycle of heart surgery patient. This slide, I will show you some box. We have tried to have the online to connect with the patient from the consultation and from the telemedicine. The platform, we would like to reduce the hospital visit because we know that a patient have the need to treatment heart surgery. They have the illness or how their health is made. They suffering from the traveling. Please, next slide. Okay, in this slide that I show you about the ecosystem healthcare, I would like to provide deeper insight into healthcare ecosystem, where we define boundary to design each part. Is including pre-hospital, it means pre-appointment or pre-operative preparation, and in hospital, we have the protocol to support the patient and their family. Maybe some patients, they have the far from our hospital. We have some area to give for their family to rest or to taking care with patient. And after patient discharge from our hospital, we have the protocol to monitoring and to support our patient. That I share you for next slide. We have the online post discharge monitoring. The service flow in this slide, I will share you. We have the feature for the service flow, including communication. We use streamlined communication with referring hospital, and we use the telemedicine for the elderly patient who have challenges with traveling and the cost for traveling. And for the pre-surgery training, we have the Line application to send the video clip to the patient to practice the breathing exercise and to learn how they prepare their self for before operation. And after we discharge the patient to stay at home, we have the online consultation from the Line application in the Thailand. We use the Line application is favored in Thailand. And we have the online consultation 24 hours for a day and 7 days for a week. For patients have something need to consult immediately, like pain or like symptom have the need to address or something, the question they need to asking. And this slide I would like to share you with we have the communication channel between patient and healthcare provider and among healthcare provider between hospital. We design easy to use. I would like to share you some of the patient with our services. If the patient have to schedule for surgery, we send the video clip to patient in the Line application, and we coordinate to the referral hospital to provide the incentive spirometer, and the patient can practice at home, and they can learn how they have the breathing exercise at home. This is the step for the patient to fit for operation. That I show you. Please next slide. We have the streamlined communication and the telemedicine also. And for the improvement plan, we identify the key area for improvement and develop to achievement. So in 2022, we launched the ERAS Recovery After Cardiac Surgery program. And also we extend to across multiple hospitals to improve clinical outcome, patient needs, and cost optimization. From our perspective, the ERAS protocol is effective and to improve our outcome. Please, next slide. Okay, this slide I would like to share you. We have been using the ERAS protocol covering in the pre-hospital, in-hospital, and post-hospital. This aligns with the patient journey. Please, next slide. And we adopt the ERAS protocol includes pre-operative. That's have the patient can train themselves for fit operation, is prepare for nutrition or prepare for health, and intraoperative is like for the pain management, because the patient have the heart surgery. Post-surgery, we need to early ambulate. If the patient have severe pain, maybe this is limited for the ambulate or for the exercise. And we adopt the post-operative for the taking care of the patient after operation. Please, next slide. Okay, this slide I would like to share you. We have modified the ERAS protocol at each key step to enhance the excellent care, starting with the before surgery. That I share you with the previous slide. Before surgery, we mentioned with the nutrition, we mentioned with the dental examination, we mentioned with the exercise, especially breathing exercise. And for day of surgery, we have evaluate for the patient fit for operation, and with the laboratory or the chest film, or also we have evaluate with the breathing exercise also. And during surgery in the operating room, we have team and we have the parameter to monitoring. And after surgery, we have the protocol to release pain, promote sleep quality, and promote to enteral feeding. And we have the follow-up protocol to monitor the patient. That I show you the next slide. Okay, that I share you with the previous slide. The care cycle with the slide has been guiding us to viewing the entire care process. There is identify the key focus That I show you this previous slide, the pre-operative. We monitoring with the percentage compliant to the preparation protocol, like a medical clearance for predict the outcome after operation. And the post-operative, we monitoring with the operative stroke and post-op length of stay. This is I think the care cycle is useful for us to guiding how we design the service for the patient to do the underwent to heart surgery. Please next slide. Okay, this slide I would like to share you with we have the protocol to reduce the hospital visit. In the patient have the elderly, we have the protocol to evaluate the patient with the video clip or with the activity living that I will share you with the next slide, how we evaluate the patient and can reduce the hospital visit. Okay. This slide I would like to show you with I use the form. This form we are using between hospital. It including evaluation is standard protocol for evaluation patient before go to the heart surgery. This is make it in the referral hospital. This slide for standard guide and referral hospital to checking the patient. And nurse coordinator, she is to arranging and coordinating between patient and healthcare provider and between healthcare provider to consultation or to conference. And the left side, the picture I will show you. This is the elderly patient activity that the family send the video clip to us for initial evaluating which pre-operative assessment for the planning for hospital visit. That I tell you we have the protocol for the elderly patient to reduce the hospital visit. This is step to build the relationship and cooperative with the patient and family or caregiver. Please next slide. Okay, this slide I would like to share you how we use the ELAS protocol. We adopt the ELAS protocol and endorse the protocol to our organization, including to the protocol cover in multidisciplinary. I would like to tell you with the post-operative, that the one of the key process. We are focusing on the promote the patient comfort, draw pain management, and promote quality of sleep and early entering feeding. It may be effect to patient have to early ambulate. And we measure and monitor to outcome. If we have some patient could not early ambulate and exercise, our team will discuss and finding the cause. It may pain or it may inadequate nutrition. Then we have the conclude and change the treatment plan to achieve treatment goal and patient needs. That we have the ELAS protocol in our hospital. Please next slide. Okay, this slide I would like to share you about the rehabilitation program. For the right side, we have the QR code for the patient and family to access to learn and practice with the breathing exercise. When the patient have the schedule for the heart surgery, nurse coordinator send the QR code to the patient or to their family. The patient or the family can access to the QR code, and they receive the incentive to practice with the breathing exercise. When patient stay in the hospital and using about the breathing exercise, and for the form in this slide, I would like to share you the document. This is for the patient or family document when we when the patient exercise or when the patient practice with the breathing exercise. After the patient or family record with the practice the breathing exercise, physical therapists come to evaluate and talk with the patient and their family how they achieve or how to change the management. I think this is the key strategy to driving the patient and family cooperative with our services. Okay, please next slide. Okay, this is one of the key strategy to improve our services to enhance excellent care. The nutrition care in heart surgery. Nutritionist is the one of the team to improve our services. That you know the nutrition care that this is the important care to promote wound healing and effective exercise. We have the protocol before admit, they admit and they operation and after operation and also post operation when they discharge and stay at home. And we have the support ingredient to the patient. If some patient had inadequate when they eat or when they cannot eat some food. Okay, please next slide. Okay, and from the pharmacist is the important from our multidisciplinary. The pharmacist support to use medication such as pain management and avoiding adverse events. And the pharmacist inform the patient to promote the medication compliance. And also, as you know, the patient have heart surgery. They have many medication taking before heart surgery. When the patient come our hospital, pharmacist have the protocol to checking. We call is the medication reconciliation to find and to prevent and to promote patient safety when they use the medication. Please next slide. Okay, this slide I proud to share with you. We have their own application developed by physician leader. Our team, good luck, we have the physician leader. He have the skill and competence with the use the technology. So we have the own application to monitoring and to measure, to monitoring daily goal and outcome each provider. That's the visual sign that you see. The green color is show achievement. And when patient have the not achievement, it show the red color. So when we have the red color in this patient, it means not achieve goal, then our disciplinary have to immediately to address or fix them. We have the problem some patients cannot eat or some patients cannot exercise. So that's why we have the team to change the plan, because we know if the patient have some problem, they can stay the hospital is longer than 5 days. And then if we can address or fix the problem, the patient can shorten stay in the hospital and they fit for the discharge and stay at home. Please next slide. And for the follow-up protocol, we conduct the protocol to monitoring and correct the data on correct the feeling or perception from the health, especially quality of life after surgery. And from our observation, we have responded to give the data when we correct with the patient report outcome around 55% to 70%. This is from our opportunity to improvement. Right now, we have to find some the way to fix this problem. We need to respond more than 80% to 100%. Okay, please next slide. Okay, From the patient report outcome, that slide I will show you, we use the EuroQOL and usual activity assessment for measure with the patient report outcome that after patient have the post-heart surgery at 3 months, we correcting the patient by telephone or by the face-to-face. Okay, please, next slide. Okay, after we have the collaborative with our network, since 2021 to 2023, we serve our patient 453 cases across 7 hospitals. That is power of network that provide the heart surgery at Bangkok Hospital Pattaya is achieved to go with increase to accessibility for heart surgery and reduce the wasting time. When we collaborate with our network, the patient can reduce wasting time for heart surgery to 1 month or 2 weeks. That's why I'm proud to present our services to enhance the patient can access to heart surgery services. Please, next slide. Okay, but for the clinical outcome that we monitoring and measure, this slide I will show you the outcome is similar when we before and after we implement the improvement plan, but the survival rate is 1 year is nearly 99 or 97% in the same year until 2021 and 2023. But in next slide. Okay. For the patient report outcome that I'm proud to share you with the return to usual activity with 3 months and return to work with 3 months. The green bar that show you in 2023, especially return to work within 3 months. That 2021, the patient report 30%. After we implement the value-based healthcare and IRAS protocol, it increasing to 89.77% and increasing to 94% in 2023. And with the best quality of life after heart surgery also, 2021, the patient report 72.50%, but when 2023, it increasing to 90%. This is for the outcome that we monitoring and we proud to present from our project. Please, next slide. Okay, for the cost optimizing, we measure and monitor the post-surgery stay. We have the goal to post-surgery stay of 5 days. After we launch the value-based healthcare and the IRAS protocol, we measure in 2022 is 50%, and we continue as to improvement and align with the IRAS protocol and fix the problem that we have. So 2023 increasing to 80%. Okay, please, next slide. Okay, that's project I will share with you with the network and how we design the service flow and how we use the IRAS protocol to improvement. That's the result is improved after we use the protocol to fix them. So for the challenges, I think we have the every project come with its challenges, and this project is what no exception. I will highlight some of the key challenges that we face. This is the mistrust. When we start the collaboration between network and when we start to use the value-based healthcare, we have many questions and need to inform the information. So the mid-start, we put more effort to share goal and to inform the information and to inform the benefit when we use it. That's why we can fix the challenges. Please, next slide. Okay, and the factor that contribute our success, along with the important lesson learned, we learn along the way, and include clear direction and executive support, and physician leadership, and particularly strong engagement from patient and their family. Please, next slide. So today and from 2022 to 2024, we implement the value-based healthcare from TIA. Now we know the value-based healthcare can transform our team, our services, and our organization. Please, next slide. This slide I would like to share you. The value-based healthcare is key strategy to driving healthcare system that I would like to be to improve the healthcare ecosystem. If we can improve the healthcare ecosystem to build collaboration to enhance accessibility for Thai citizens and to improve the outcome, the patient report outcome and the clinical outcome, and why we how find a way to reduce the cost or cost optimization. That's the powerful of value-based healthcare to create the value for all. Please, next slide. Okay, for the last slide that I will share with our project. We conclude the enhanced recovery after cardiac surgery program supported by technology enhanced high-value care across the entire patient journey. Telemedicine can reduce pre-surgery hospital visit, especially elderly patients, while the Line app facilitates effective post-discharge recovery monitoring. And ongoing program improvements taken the connection between patient, family, and healthcare, driving better outcome and cost optimization. And the last, collaboration with government hospital can expand the program and increase accessibility for Thai citizens in Eastern region. Okay, to conclude, I hope this session to have provide valuable insight. Now, I love to hear your thought and answer any question you may have. And thank you once again for your time and your attention.
Thank you so much. It was fantastic presentation. Before we move to Q&A, I did get a message that apparently my video as well and audio were slightly freezing at the intro session. So I'm going to blame Zoom for that one. I'm glad that our guests had a smooth digital journey and we were able to see all the slides you've prepared. So let's jump to some of the questions. There are quite a few in our chat. I think one of the questions that's been coming up, you've shown interesting results on the chart, patient improving quality of life, for example. I think the question here is, how are you measuring it, or which prompts are you using to measure? Which tools are chosen? Do you have an app to use to measure? So if you could expand a little bit more how you track that information from the patients.
Okay, thank you for your asking for your question. As I show you the previous slide, we use the EuroQOL to measure and correct the data from the patient. First, we have the protocol to follow up the patient for 1 week, 1 month, and 3 months. And we inform the patient how the benefit when they give about the information when they asking them. And when we inform them and we have we inform them for the benefit. So we have the channel, or we have the tool easy to the patient have to give the information. Maybe use the telephone, or maybe read the paper for them. Then patient understand they are cooperative to give the information. But from our perspective, from our observation, now we need to improve, because we can correct the data from our patient around 55% to 70%. We can correct the data from the patient is more than 80 or to 100%. It can address the data to improve our services.
When you hear your ambition of 100%, it's actually wonderful to hear. And I hope the audience is as impressed as I am. I did notice, you have that kind of unique way of empowering your patients and engaging them in the full process. Are there any approaches, your top approaches you could share with our audience? I know this is something that many of the clinics and providers often struggle with. How do you bring patients on board so they stay with you throughout this journey?
Okay, that I show you, we decide the service flow. We divide the parts of the pre-hospital, and we have the coordinator to connecting with the patient, to build relationship with the patient, and to support the patient or their family, how they come to receive the service with our hospital. And when they stay in the hospital, we provide the information and we provide the services to support them. And I think this is the relationship, and this is when we inform the information to the patient, how the benefit and how the useful when patient give the information with us. I think is the key important.
Thank you. There's also a question around, you've mentioned how and what you do to prepare the patients about nutrition counseling and this whole rehab kind of preparations with the patients. But we have to comment, what else is there, because it seems a little bit, obviously just informing the patients what they should do will not be enough. So what's there? What's the a key ingredient or magic ingredient you use to prepare the patients and see these remarkable results of improved or shortened length of stay and improved recovery?
Can you hear me?
Yes, thank you.
Okay. So from my point of view, that I think our team that they design dedicated person for ease of patient care, especially for the nurse coordinator. She is the main coordinator that engage the patient in the beginning to engage the patient in our journey. When the patient decides to receive the operation in our hospital, and our nurse coordinator contact the patient since they stay at home and inform all the process that they will receive in the treatment in our hospital, including the nutritionist support and consultation, and also provide the video clip to do the rehabilitation since the patient stay at home before they come in the hospital. And then the first time when the patient visit the hospital, they already engage with our team. And then after they stay in the hospital, that we can provide the explain the whole journey that the patient will explore in their journey for the surgery. When we can engage the patient in the beginning, it will be easier to our team to talk with the patient and also give some information and also get the feedback from the patient. the one example that we faced that firstly in the project, our rehab team that we cannot engage the patient to follow up with our team, that they maybe because of our doctor and our rehab team may not engage the patient when they stay in the hospital for 100%. Maybe we can just provide some exercise tests or help them to work, but we didn't provide some information after they discharge from the hospital, and we didn't inform them for the benefit for rehabilitation after they discharge from the hospital. And after that, our rehab team tried to provide some information and benefit from the post-discharge rehabilitation program. And then we can engage the patient with our team, and then we can increase the follow-up rate for rehabilitation team. I think the key success factor would be the engage the patient with our team in the beginning. If they understand the whole process and they know the result that will coming if they engage with our team, that is really helpful to engage the patient with a good result.
Excellent. Thank you so much. So I think this is all what we see as well up in the world, like engaging the patient, educating them, but also telling them about the benefits. Yeah, that's fantastic. And the results you are showing are really remarkable. I'm going to move to a slightly different set of questions. As I can see in the chat, we have our audience asking about, would you provide some insights of how you reduce cost to add value? What kind of strategy used in this process? So if you could share some examples of that cost component.
For the cost component, I think we have like maybe two key strategies for the cost optimization. The first thing is about the provide the more accessibility to our patient, that they don't need to come to the hospital. That often that we can communicate with the patient by teleconsultation or teleeducation, that can reduce the patient time to visit the hospital. We can prepare them well, and also we provide some of the protocol to the hospital, to the original hospital, that they will send the patient to us, and we use the same protocol to prepare the patient. That really save time to our patient, to don't need to transportation to a hospital. And when they and the other thing is about the ELAS protocol. ELAS protocol, that if we comply ELAS protocol well enough, that we can reduce the length of stay, we can reduce post-op complication, we can reduce post-op reoperation. That really benefit to our team, that we can have more experience, that we have the more competency to educate the patient, and also our team can have can know the way to treat the patient, that we can discharge the patient within 5 days. And when we can reduce the length of the stay, that the cost will going down.
Excellent. Thank you. And I'm guessing there will be more information or data coming in as this program is roll out over time for you to better understand the cost impact. The other kind of questions I can see here are really around the leadership buy-in, and how we've talked about that this journey has been taking you quite a couple of years plus. So there's clearly you've managed to put a sustained effort for this initiative. So what did it take and how long? And perhaps you could tell us a little bit more about that support from the leadership, and then how did that help you to achieve your goals?
Okay, from the leadership support, I think start with the direction and the resort, and with the direction, the leadership tell us for the goal and how the way we can achieve goal. And the second, the leadership to breaking with the obstacle or to support our team when we have the problem, when we know the idea, how the way when we working every day. But the leadership can easy to accept and provide the idea and provide the recommendation, and we can step forward and how to improve our team. And also the leadership to provide with the structure that I showed you in the previous slide. Our success from key success with the key area with the organization chart, because for the IPU that I mentioned, we have the structure with the including a center of excellence, including outpatient heart clinic and cardiac cath lab and cardiac care unit and post surgery care in the cardiac ward. So the structure is the main effect to driving and cooperative between our group. And also the leadership could support when we connect with our network. So that the powerful of network. If we don't have support from the leadership, we cannot collaborate with the network, and maybe it's challenging for us when the leader to leading and support us to connecting and to collaborate with the network. That's why we have the success with can extend to 7 hospitals when we use the value-based healthcare and when we collaborative with the government hospital.
Excellent. Thank you so much. I wonder if maybe there's a little bit of just clarification from, extensive presentation, but within the BDMS network, and you touched on that as part of the sustained buy-in into the whole project. So within the BDMS network, are other hospitals doing these activities as you are? How is that being? Is this some sort of a shared learning, or how does that work?
So as a leadership team, that after we study about value-based care in Thailand, that really new in Thailand, that about value-based care, that no one knew how to make it happen, and we open with our team to learning about value-based care. And then after we see some of the good results and good outcome, and we apply to accreditation by ICHOM. And this is the good opportunity for us to learn about how to measure about the patient report outcome, and to study and learn about value-based care and also care cycle. And after we apply the care cycle, we see the good result, and also both from the clinical perspective and also patient perspective. And we share with our network, both 58 hospitals in Thailand in BDMS network. And then I think we engage most of the hospital in BDMS. And now today that we have more than 20 hospitals that engage the value-based healthcare and apply the ICHOM accreditation now today. And for the Bangkok hospital in Eastern region, as we are connected together at the location we close by, and we try to implement our protocol for the ACS pathway and also hypertension treatment. We share our guideline and protocol to our network, and we use the same protocol, and we implement the patient report outcome that we need to measure in not only in Bangkok Hospital Pattaya, but we expand to our network in Eastern region. And now today we are waiting to see the result for the outcome from our network. And if we see any result from the network, I think maybe we can tell you later.
Excellent. So there's the power in collaboration and networking. Do you share any data between each of the group hospitals, or rather just protocols and approaches to this initiative?
Can you say it again?
Can you
I'm
share
sorry.
any data, the actual kind of outcome results between each other?
Yeah, we share our results to our network in VDVET in Thailand, that we have academic conference that engaging all the 58 hospitals together, and we have the opportunity to share our results for the heart surgery project, and also show the result that we can accredited by ICHOM, and show the result for the patient report outcome is outstanding to our network. That's a good opportunity that we can share on that stage, that we engage with people, and then we can like a Q&A to ask them why you need to do the value-based healthcare, and then we can share them that after we don't know that is the right or wrong to do on that way, but we see the result, and I think any way that can make the our patient outcome is better, I think that is good anyway.
Excellent. So I can see that, opportunity to exchange the learning, opportunity to, as in any quality improvement methodology, basically take what's working best and then use it in your settings. So that's fantastic. You've mentioned in your presentation the app you use for the ERAS app for to track certain activities. So that's actually a question from me. I was wondering, how this app is being accessed, by who does it? I know often people are telling that, oh, there's one other software or instrument that we have to be working with. So tell us a little bit of this journey. Clearly, this is something that does help to engage clinicians and your clinical team, and ensures that you follow the steps to engage with the patient. So how that app came about, and is it part of your larger electronic health record system that you can then use and track some additional data from it?
Okay. First, when we have the schedule for heart surgery with the patient, nurse coordinator puts the name list into the app, and we have the assignment for the each department that patient can for the patient journey. When patient admit to the cardiac ward, the nurse in the cardiac ward put some information in the app, and when the patient stay in the operation and transfer to the CCU, nurse at the CCU put the outcome and put some information in the app, and also multidisciplinary nutritionists and physiotherapists, they can put from their role within the app, especially within the breathing exercise is an achieve goal, how the patient can do, or how the patient now the patient can exercise or cannot. And with the nutritionist, they evaluate the patient at the daily assessment. After the nutritionist assessment the patient, if the patient inadequate nutrition, they put some data in the app, so multidisciplinary can see the data from the app that I show you. If the red color is not achieved in this section, it's like inadequate from the nutrition. Maybe we talk with the doctor to change the management plan. Maybe put the nutrition in invasive line, or entering for NG2 for feeding the entering for the feeding. And for the breathing exercise, we have the go-to monitoring when patient stay in the ICU for the after operation, post-operative in 1 day, we try to patient to early ambulate and try to promote the patient to walking a day when the patient can walk. So when patient exercise, and we have the measure like a 6-minute walk test. If the patient cannot do the 6-minute walk test, we put the data in the app that the physician can see the result. when the patient, when the physician see the result, they have to discuss with our multidisciplinary to improve our outcome before the patient discharged at home. So that's why I think the app is useful for us for monitoring daily goal and for communicate with our multidisciplinary to improve the treatment plan, can decrease the complication and reduce the hospital stay. This is our to use the app, the ELAS app.
So may I add a little bit more? The ELAS application that we built up according to is just a program that we developed from Power BI that we engage the patient, allow the patient decide the care that we would give them along the patient journey that they stay in the hospital, and we decide the care map in the Power app that in the day one maybe nutritionist or rehabilitation need to join in the program, and this app can share with with the multidisciplinary team that they can look into the patient journey. It's like a dashboard for the day one. How many multidisciplinary team need to visit the patient, and what about the outcome after visit the patient, and we can communicate together to each other. We tracking until the day one when the patient admitted until they discharge, and then we can know that this is the day 5 that the patient admitted, and after day 5 that what thing that happened, because our target is about 5 days, and after 5 days the patient may have something wrong, and then we can detected by that application and detected by the dashboard. That it like they can alert our team to take care of the patient earlier. But the application now today is like the program that was separate from our HIS. Our next step is maybe integrate from the application into our HIS system. That's more easier for our team to tracking the data, and so they can alert our team that we can work together more easier.
Excellent. Thank you so much. And really a great example. I can see we have like maybe a few more questions here. I know I already asked you a question about examples of the cost reduction, but I can see in our Q&A box, our audience is asking about, you are increasing the cost of care potentially for some of the components, the footfall increase. So how is that, working for your shifting the costs, and how do you work with the management as well around those challenges, that the costs may be shifting in different directions, or by increasing the activity at some areas, the costs actually may be going up as well to some extent?
For the cost measure that the first at the beginning of the project, we analyze the data for our cost for cardiac surgery in our hospital. Our cardiac surgery in our hospital, example for the CABG, the open heart surgery, the average cost is around 250,000 Thai baht in Thailand in our hospital. And we can, after we use the ERAP protocol, that we can engage the patient and we can prepare the patient well enough that they don't have any complication, and also provide the education and prepare the patient to stop some medication, smoking cessation, prepare for the nutrition for the patient. That if we can prepare the patient well, and then the complication will less happen. And after we do operation more and more, that our team can have the experience, also expert in some of the in operation room, that we can reduce operation time as well. Our team in operating room, they can learn from each other that how to do the cardiac surgery within in the efficient way, and what kinds of medication or what kinds of medical equipment or medical supply that we need to use. Example for the professionist that they can use our team to the
but like pump
from the some instrument in the for the professionist that is about the
heart lung machine,
heart lung from the medical supply for the heart lung machine, that we have the two companies. that we try to to compare for each company, that can save our blood component, and we can see that a company have some more efficiency, and also they have some save more blood component than the other company. And we try and do the mini research that we compare to 10 patients for the both of the company, and then we found that the A company has more efficiency than the other, and we can save the blood component after that, and then we change the medical supply to the other company. That like experience that we can learn along the way to the patient care in operating room. It's just an example that we can lower the cost for cardiac surgery.
Excellent. Thank you. I am trying to kind of get my attention with you as well, all the questions that are coming. I do want to let know all of those who are on the call with us today that we will, if we didn't have time to get to your question during the live feed, we will be answering those questions after, and so you will get the answer to the question. I want to do just maybe very final question about the prompts, because I think the answer will somewhat link to back to us as an ICHOM. Are your prompts and data prompts audited in any way? How do you, I guess the person who is asking, wants to know how you track the quality of the prompts data?
So from the prompt data, that after we try to collect the prompt data in our hospital, before we use the prompt data, we collect only for the clinical outcome, but we don't know about the patient outcome, that when that they can walk, when that they can go back to their normal life. And after that, when we use the prompt, that we can see the outcome from the patient and also the patient feedback. It's really impressive to our team. Patient feedback quite excellent. I think some of the patient feedback to us that they can go back to their life on someone, that they can do more activity more activity than they before the surgery, and so they can go back to their normal activity even better than before operation. And the other one that we see that after we collect the prompt data about the patient quality of life. And the other thing that we see that about the mental health from the patient, for the trait from the patient, that we see that at the beginning, the patient really stressed from after the surgery, that they don't know how to manage themselves and how to do the activity after surgery. Some of the patients that they really scared to do the normality, that even the climb up the step, they don't even brave to do. And after that, we can try to integrate them and also make them comfortable to try to enhance them some of their activity. And after that, the result really fantastic. The patient more understanding and also feedback to our team that really excellent outcome. And now today that we try to apply the mental health. And also apply the 2Q, 9Q to assess the patient for the mentality after when they stay in the hospital. And we can, in some patients that they feel really stressed or without any problem, we can consult psychiatrist accordingly. After that, I think that we're really efficient that we can use some of the patient report outcome that can improve our process and also improve our patient outcome and also patient satisfaction as well. It's very impressive to our team.
That's great. I'm going to just add one comment to that question as well. I mean, you are part of ICHOM accreditation program. I think it's worth mentioning that you use a lot of our ICHOM sets and the prompts that are endorsed by the working group members in those sets. So I think that also adds the validity to the work you are doing. So and we really look forward to your next steps and how this program will be evolving. So I have some just final announcement before we finish. Can I have please next slide? So anyone, if you got inspired by this story, this journey, from our colleagues in Thailand, and you also want to be ICHOM accredited, please do visit our webpage on ichom.org. You can fill in the form and we will get back to you with more information about the whole process. Next slide, please. I also want to remind you that this is obviously a webinar series, and we'll be having another of these great talks in March, 27th March. We will be talking about 7 years of value-based healthcare in Brazil, lessons and future perspectives. So please do join us. It's free to attend. You just have to register and follow the link. The next slide. ICHOM education program. I think quite a few of you know about it by now, but we want to remind you that the subsequent cohorts for this year, the next one, cohort 2, will be starting on the 10th of March. So again, if this is something you are interested in, you want to widen your knowledge about value-based healthcare, please do register following the QR code on the screen. And the next slide, I think this is the very final slide. We are very excited to be going to Dublin. By we, I mean an ICHOM team. So this year, ICHOM conference will take place 1st and 2nd of October at the Convention Center in Dublin, and the registration is now open. So if you want to save on your pass, please do follow the code as you can see here, or visit us on our webpage. So I think with that, I just want to again thank you all for joining us today. Thank you, our guests, and goodbye.
Goodbye. Thank you.